this afternoon. And if you're joining us for the first time and you'd like to ask a question of Mayor Holder or Carol Young-Ritchie or Dr. Summers, just click on the question mark inside the text bubble here on Microsoft Teams to ask your question. And when you do, if you could indicate your name as well as your media outlet and who your question is for. We already do have several questions in. Just click on that question mark inside the text bubble to make sure your questions get in. And finally, a welcome to those who are watching this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, and also those who are joining us on the CTV London website. Let's Mayor Ed Holder. Mayor Holder.
Well, thanks, Dan, and good afternoon, everyone. First, I'd like to wish a blessed Ramadan to the thousands of Muslims here in London and right across our region. This holy month of fasting began over the weekend, and I personally pray for a memorable and meaningful Ramadan for all who mark the occasion, and thank our Muslim community for their generosity of spirit and their sense of community as they have demonstrated time and time again, in particular during this holy month of Ramadan. On a separate note, I'd also like to acknowledge the first ever Public Health Week here in London, Middlesex, and right across Canada, running from today until Friday. You know, this week's been established by Canada's public health associations as a time to recognize the important contributions of public health right across the country. Well, it also highlights issues that are important to improving the health and well-being of individuals in our communities. You know, we're truly blessed here in London, Middlesex, because we have so many public health professionals who've worked and continue to work so exceptionally hard on our behalf. Our medical practitioners, our administrative staff, and everyone who plays a part in public health. We say bravo. We also say thank you. Much of our focus where public health's been concerned over the last 2 years, as we know, has been centered around COVID, and for good reason. They've done phenomenal work, especially with our historic vaccination campaign, and truly their work extends far beyond COVID. Oftentimes, though, these efforts go unnoticed or perhaps underappreciated, and it's why Public Health Week is so important and such an important recognition. So let me say to you, Dr. Summers, our Chief Medical Officer of Health, and to all those who work alongside you at the Middlesex-London Health Unit, to all those who have made contributions to public health, especially during the pandemic, thank you. Thanks for standing up and delivering when it matters most. And we couldn't possibly appreciate the dedication you all have and the stress associated with the work that you do. Please know that we absolutely appreciate each of you. So once again, on behalf of myself, on behalf of London City Council, on behalf of our administration, here's to you on Public Health Week, and from my heart, sincere thanks. So that's all I've got. I'll turn it now over to you, Dr. Summers.
Thank you, Mr. Mayor. And on behalf of the Middlesex-London Health Unit staff team, thank you. We are humbled by your words. It is Canadian Public Health Week in Canada, running from today until Friday. And as a local public health unit, we are taking the opportunity to reflect on our work and to highlight what we do beyond mass vaccination and beyond outbreaks over the last number of years. I think our community's gotten to know us at the health unit a little bit better. But we were around here before too, and we continue to do the work of food safety, infection prevention and control, the promotion of physical activity, healthy eating, early childhood development support, school health, tobacco control, the list goes on. And we'll continue to do that work now and beyond as we move out of this pandemic in good time. Public health is completely dependent on the support and involvement of our residents, our partnering organization and agencies, and different levels of government. We are so grateful to be part of this community, to work hand in hand as we protect and promote the health of our residents, those who live, work, play, and call London and Middlesex home. It's an honor to be in public health in our community, and for that we are so thankful and grateful. The pandemic is not over yet, unfortunately. And as we sit here today, cases are rising both in the London and Middlesex region and across the province. The health unit is reporting an additional 82 cases today. Over the weekend, 84 cases were reported on Sunday and 126 cases reported on Saturday. Regrettably, 2 additional COVID-19 deaths were also reported, a female in their 80s as well as a female in their 20s. The female in her 20s, regrettably, was not fully vaccinated. Although COVID did contribute to her death, it was not the underlying cause. Across the province, as I mentioned, cases continue to increase, and I want to highlight that the risk of COVID-19 in our community is very high. The amount of COVID that we are seeing right now is higher than at any other time in this pandemic, aside from the peaks of January 2022 during the initial parts of the Omicron wave. We, in many ways, are heading into what is likely our 6th wave as a community, and a wave in which it will be all the more important that each of us, with our families, our friends, and our community partners, take precautions to protect ourselves during this wave of COVID-19. I strongly recommend that individuals continue to wear a mask, as we have recommended still throughout this winter and spring season. Wear that mask when you're in indoor events, when you are out and about. Even if it is not required, it is still a simple, cost-effective way to protect yourself and limit your risk. It's also essential that you ensure that you are up to date for all recommended doses of COVID-19 vaccine, including that booster dose for those that are 12 and older. The vaccine and the booster dose is absolutely essential from taking this tragic virus and making it a milder illness. It is essential that everyone who is eligible make sure they are up to date with their COVID-19 vaccine. Make sure that you stay home if you are unwell or develop any COVID-19 symptoms. In doing so, you are protecting those around you. And during this high peak of activity, I would also ask that you consider to limit some of your social interactions and keep those social circles smaller. We will get to a point in time where we are not limiting our activities because of COVID-19, but we are still in a time where that is a way to protect yourself and to limit your risk. Use your social interactions as though it is a savings account. Don't spend it all at once. Space it out, and in doing so, you can limit your risk. As I mentioned, getting vaccinated remains an absolutely critical way in order for you to protect yourself, and the vaccine remains readily available in our community. We are excited to announce that we've partnered with White Oaks Mall to operate a new COVID-19 vaccine clinic at the mall starting this Thursday, April 7th. The health unit last ran a COVID-19 vaccine out of the mall in the fall of 2021, and over 5,500 doses of vaccine were delivered in that clinic. Reopening the clinic at White Oaks is an important part of our strategy to make sure the vaccine is available to those who need it and for those that aren't able to get out to a mass vaccination clinic. So if you're at White Oaks, if you're next to the Tim Hortons near the food court, you will see our clinic from Thursdays to Saturdays open from 1 p.m. to 7 p.m. Swing by, get vaccinated, whether it's your first dose, your second dose, or your booster dose. It's always the right time to get vaccinated. This past weekend, we celebrated Superhero Saturday again at the Western Fair District Agriplex. Over 200 people got vaccinated. Thank you so much to our community for rolling up your sleeves, for continuing to do the good work to protect yourself and your community and our healthcare system, and for taking care of yourself. As I mentioned previously, it is an absolute privilege to serve in public health in our region, and it is because of our community's willingness to support our public health work that we have any success. Thank you to all of you, and a happy Canadian Public Health Week. I'm now going to pass things on to Carol Young-Ritchie from London Health Sciences Centre.
Thank you, Dr. Summers, and good afternoon, everyone. And thank you for having me here to share an update on the COVID-19 situation at London Health Sciences Centre. As of this morning, we are caring for 47 COVID-19 positive inpatients, and we have 5 or fewer of those patients in critical care. In our children's hospital, there are 8 inpatients with COVID-19 and no patients with COVID-19 in the pediatric critical care. We currently have no units on outbreak. This is largely due to the hard work of our partners in infection control, as well as our unit staff who have worked diligently to end outbreaks as soon as possible. I'd like to take a moment to acknowledge these individuals, as we do recognize the additional stress of an outbreak can cause with staff. Thank you for everything you do and to keep our patients and other staff members safe. With that being said, over the past week, the numbers are continuing to rise. Both our staff testing positive and in our community. That is an expected outcome of the restrictions relaxing and seeing mandates such as mandatory masking lifted in many places. We'd like to encourage our community to please continue to exercise caution and follow public health guidelines. Get vaccinated, including the 3rd dose booster, physical distancing, masking, and proper hand hygiene. Finally, as today is the first day of Canadian Public Health Association's inaugural Canadian Public Health Week, I'd like to take this opportunity to acknowledge the importance of our partners in public health. While the past 2 years have certainly highlighted the importance of vaccines or managing outbreaks in our community, they have been an important partner for many departments at LHSC for many years. Healthcare is a team effort, and their work has been integral to our ability to offer patient-centered care at LHSC. Thank you for your ongoing partnership and support. Thank you. Back to you, Dan.
Thank you, Carol Young-Ritchie, Dr. Summers, and Mayor Holder. All right, we do have a number of questions, so let's get to them right away. The first question this afternoon is from Dan Brown at the London Free Press, and this is for both Dr. Summers and for Carol Young-Ritchie. Dan asks, the Premier said Ontario is experiencing, quote, a little spike, end quote, of COVID-19, and that it's manageable. Do you agree with this assessment? And at what point do you think the situation becomes a more serious problem? Who would like to respond to that first? Dr. Summers.
Thanks so much, Dan, and thank you, Dan Brown, for the question. There is an increase in COVID-19 cases across the province. It is an anticipated one. When the public health protections of capacity limits and masking were scaled back, it was only a matter of time that we would see an increase. And in fact, over the last number of weeks, the fact that we've been holding steady without going down further is an indication that things were starting to wind up to increase. So we will see an increase in cases over the next number of weeks. Unfortunately, with the infectiousness of Omicron and the effectiveness of the vaccine, the herd immunity that would stop COVID in its tracks is not possible at this time, which means we were never going to stop Omicron transmission as a community. We were only going to slow it and make sure that when people were exposed, they had as much of an opportunity to protect themselves as they could. What that means right now is that over the next little while, we will continue to see more and more cases, which is why it's so essential that people recognize that there's a very high risk of COVID in our community right now. And so particularly for people that are at higher risk of poor outcomes from COVID-19, it's critical to take all the appropriate precautions to protect yourself. If you are elderly, if you have medical comorbidities that may mean that you are less able to handle a COVID-19 infection, it's really essential that you have your vaccines up to date, including that booster, that you are masking, and that I, at this point in time, would recommend avoiding in-person, large in-person gatherings. Again, the risk over the next little while will be high. Dan, you also asked about whether or not we agree with the assessment that it is manageable. With context, I think it depends on what we are talking about when we say what is manageable. The healthcare system capacity has been the key endpoint that has dictated a lot of public health measures like capacity limits, lockdowns, etc. I cannot speak to exactly what the capacity of the system will be. I know that the province is watching that closely. It is unlikely, highly unlikely, that the number of hospitalizations and ICU admissions will be higher than what we saw in January and February during the first round of the Omicron wave. However, we will see an increase in hospitalizations as a result of this increase in cases. That is anticipated. What is not entirely clear is how high that increase will be. The COVID-19 science table did release a couple of weeks ago some models which suggested a low to moderate increase in hospitalizations. I think we will likely be closer to the higher end of those projections, but again, to be seen. So for our community, the critical thing in all of this is there are still tools, as you've heard me say before, in your toolbox that can reduce your risk and the risk of those around you. Vaccinate, mask, stay home if you're sick, and limit your indoor large gatherings, particularly if you are at higher risk from ending up in hospital. Carol, I would pass over to you for any further comment.
Sure. Well, I can say we've had 5 waves so far, and the hospital has maintained a high level of readiness for what comes. So we have continued to watch the metrics daily and respond to what's coming. So we are ready to respond if we go into a 6th wave. What's really important is that we will continue to provide our essential services, which we have right through the pandemic, and urgent and emergent work. We are continuing to watch our health human resources really carefully, how many of our staff are off sick, and the care that we're providing, and we will respond to that as we go through this wave or waves to come. We haven't relaxed many of our masking policies and visitor policies here at the hospital. We've been very cautious with that, again, being ready to respond what comes, and certainly to provide care that we're going to need to our community as this next wave comes on.
Well, thank you very much, Carol Young-Ritchie and Dr. Summers. We've got a follow-up question from Dan Brown, and again, it's for both of you, so we'll follow the same order. And Dan's question is this: what numbers will you be looking at most closely this week? And by that, I think he's asking about hospital admissions, new cases, that sort of thing. Dr. Summers?
Thanks, Dan. I'm never looking at one single number, but the constellation of all the metrics that we have available to us. So allow for me to run through that ever so briefly. We will be watching wastewater data. I received updated wastewater data this morning from our academic partners, and it is rising. And it is at a level that is still lower than what was seen at the peak of the Omicron wave in January, but is higher than what has been seen at any point in time preceding the Omicron wave. So the wastewater data is trending up. We've already seen that. It's not a surprise. We will continue to watch case counts. We will continue to watch the percent positivity of the tests that are being done. And we will continue to watch hospitalizations, ICU admissions, deaths, and outbreaks in long-term care homes, retirement homes, and other congregate settings. Those metrics are the ones that inform us about where we are trending. Right now, as we sit here on April 4th, I anticipate that over the course of April and into the beginning of May, we will continue to see escalations and elevations in all of those metrics. What is unknown is how quickly those things will rise and how high they will go. If we fast track to June and July, I anticipate we will see a decline as warmer weather kicks in, people spend more time outdoors, and as we accumulate more community immunity from people with previous infection after this subsequent wave. But the pathway from here till June or July will involve an escalation through April of all of those metrics. Carol, anything to add on that?
Sure. I would just add that we continue to partner very closely with the health unit and what's going on in our community. Here at the hospital, we're watching our metrics closely about how many staff we have available to work, how many of our staff have COVID, the number of patients coming through, the number of patients in critical care as part of our regional system. So we watch those things very carefully and continue to do so and respond as necessary. Again, making sure that we're providing the essential services that we provide in urgent and emergent work.
Thank you both very much. Let's go to, I think, the last question we have from Dan Brown, and this is for everyone. So I'm just going to throw the question out there, and we'll see who'd like to answer this one first. All right. So here's Dan's question. I know there's no hard numbers, but I'm just wondering anecdotally, what percentage of people do you see who are continuing to use masks at this point? I saw a hand come up. Mayor Holder?
Sure. And Dan, I'm glad you used the word anecdotal because there's no science here at this point. So it's observational and so in this last week, let me just share some of my own personal experiences, and that'll probably give you my best sense. So I needed to be in hospital last week, and when I was there, I can tell you with confidence, 100% of everyone was masked, from staff and physicians and nurses to patients. So Carol Young-Ritchie, thank you. I felt better knowing that, and I was one of those. When I was at church and grocery store, I'd say probably 2/3, 75% were masked. You know, the greatest majority were masked in those two settings. In outdoors, almost nobody. If they're out walking in the park, pretty much nobody. And the only other observation is, as you'll recall, at one point I indicated that there may be some advantage to some shops that say masking is required to come in. And I'm talking about retail. I haven't seen one yet. So, and I know in my wife's own retail experience in her business, my wife and daughter choose to wear a mask, and people come in as soon as they, even though it says mask not required dinner, as soon as they see my wife or daughter in the shop, they'll say, do I need to wear a mask? And even though they have a supply of masks available for customers, the answer is no. And so I think it depends on your experience, and that's certainly been mine.
Thank you very much, Mayor Holder. Dr. Summers?
I think Mayor Holder's observations are consistent with what we are seeing. I think it's very setting dependent as to how many people are wearing masks. When I was grocery shopping this weekend, saw significant mask wearing, actually. I think similarly around that 75% mark. So we know that it's going to be dependent on the settings where that is occurring. I know that our colleagues at Aeolian Hall continue to require masks as an example, and so any of the concerts at Aeolian Hall are totally masked. And again, masking is not meant to be a moral question. It is a tool in people's toolbox, particularly for those at higher risk, that can be used to protect yourself and protect those around you, because it is an effective way at preventing you from transmitting to others if you have COVID-19, from limiting the transmission of COVID-19. So please, even if you are in settings where nobody else is masking, you can mask, and I would strongly recommend that you do, given the risks that we are seeing as we speak.
I'll just jump in on the hospital side that we are 100% masking. We are universal masking. And why are we doing that? We want to protect our patients first and foremost, and we also want to protect our staff. So we will be masking for the for quite a long time, for the unforeseeable future. And again, it's with safety in mind that we're doing that and to protect our healthcare system.
Thank you all very much for those responses. Let's go on to our next question. It comes to us from Sophia Rodriguez at CBC London. Dr. Summers, Sophia asked, it's been 2 weeks since March break. How many cases could be a result of travels and gatherings during this time? Was there a spike in cases?
Hi, Sophia. Thanks for that question. We are seeing an increase in cases across the board, and that increase is being driven by an accumulation of things. In mid-February, we saw lifting of capacity limits, and at the beginning of March, we saw a removal of capacity limits in indoor environments, as well as a removal of the vaccine passport system. So we now have kind of 6 to 8 weeks of gradual scaling back of those public health protections. It is likely the removal of capacity limits at the beginning of March that slowed down the descent in cases and started to see cases start to increase. I wouldn't specifically tag this increase due to March break travels and gatherings. I think this is a more comprehensive change in the behavior of people in our community as a result of changes in public health measures. We have not seen a specific spike in cases because of March break. It is the escalation we are seeing right now is from all of those things combined.
Thank you very much. Let's go to the next question, and it's a follow-up from Sophia Rodriguez for you, Dr. Summers. Has the region entered the 6th wave of the pandemic? And we've already talked about this a little bit. If so, what do you expect this wave to look like?
Thanks, Sophia, for that question. I think we have entered a 6th wave of the pandemic, absolutely, for our region. This is a wave that's being driven again by Omicron. It's not a new variant. It's the same variant that was here, but it's just finding its way to anybody who was not protected the first go around from either previous infection or a booster dose. You've heard me say before, it's a matter of time, particularly if you are unvaccinated, before you would be exposed to COVID-19 and subsequently develop it if you're unvaccinated or if you've not yet had your booster. This wave will not spike as high as the previous Omicron wave. So it's not going to go as high, but it's still likely going to look higher than most of the previous waves. What we also don't know is how condensed the wave will be. It might be more drawn out, not clear. And the most critical thing that we're watching for is what it'll mean for hospitalizations and ICU admissions. I do anticipate that we will continue to see escalating cases through April, and then as the spring weather kicks in and as essentially we have broad community immunity from previous infection as well as booster dose coverage, it'll start to decline through May and onwards. Again, there's a bit of a crystal ball in all of that, but regardless, we are not yet at the peak of the wave by any means.
Thank you, Dr. Summers. The next question from Sophia Rodriguez is for Carol Young-Ritchie. Sophia asks, according to LHSC, at least 229 staff members have COVID-19. How has this impacted operations?
Yes, thank you, Sophia. And yes, we do have 229 staff members reported COVID positive today. Like most organizations, healthcare organizations, Health Human Resources is stretched right now. This hasn't impacted our hospital operations, but we continue to watch every day how many staff are available. We do have contingency plans in place if we are running into a staffing shortage. And again, we'll be focusing on our essential, emergent, and urgent surgeries or cases.
Thank you very much, Carol. Let's go to the next question. And this is a follow-up for you, Carol, from Sophia Rodriguez. Sophia asks, we've heard from neighbors of the Carling Heights Arena who said they would like their community center back. At the height of the pandemic, the assessment center was doing 700 COVID tests a day, but that number has gone down to 80. Is this assessment center still necessary if the criteria for testing is limited, and why?
Yeah, so we were asked to run this assessment centers through Ontario Health and the Ministry to, again, in response to COVID. What we do know is the numbers are coming down, so we are working with community partners and with government partners to look at how we can ramp that down and if the Carling site is the best site. So don't have an answer for moving out anytime soon, but again, appreciating that this is has an impact on the community, using the community center, and we'll be working to see where it's best located.
Thank you very much, Carol. Alex, Dr. Summers, you've got a follow-up.
Hello, you've reached me.
Yeah, just quickly to add to Carol's comments, the Carling Heights Assessment Center is also a clinical assessment center, so it's not exclusively just for testing at this time. It is also the gateway to early COVID-19 treatments like Paxlovid. So it's playing a key role as an antiviral treatment access point. And the primary care network in our community is funneling and transitioning patients through that clinic. So it's playing a different role than it was previously as not just an exclusive testing center. So even though, yes, there's a dramatic difference in the volume of tests being done a day, but the nature of the work has also changed. So it still plays a very critical role, just to highlight that.
Thank you very much, Dr. Summers, and thank you, Carol. There is one question left in the queue, and I do want to preface this one. We go through all of these questions, and we want to make sure that we can ask the ones that we can ask. And I am going to proceed with the next question, and I've got a thumbs up from Mayor Holder. So this is a question from Dan Brown at the London Free Press. And Mayor Holder, Dan asks, actually, it's more of a comment. Mayor Holder, you weren't in hospital for a COVID-related reason, were you?
Dan Brown, no, I was not.
There we go. Thank you for the question, Dan, and thank you for the response, Mayor Holder. That does bring us to the end of the questions for this afternoon's virtual media briefing. Thank you for joining us. We will be back next Monday afternoon. That will be the 11th of April at 2 p.m. We hope you will join us then. Thank you so much. Have a great rest of your day, and so long for now.